Well, here we are, Renee, another episode. How are you doing today? And what are we talking about?
Well, I'm doing great. I'm at home and you're out and about again, so that's not a surprise. But
Out at home.
I know you're not at home. We got a really cool episode today, and hopefully people
Yeah.
will really enjoy this one because we always hear this complaint out and about while we're doing our jobs that people can't find funding for things. And so what we're going to talk about today is funding for technical support and the dollars that are there to help you. And there really are dollars out there in lots of different places. And so we're going to kind of run through some of the things that just we know from our own work. And that comes from the corrections side as well as mental health, but there's a lot of different funding opportunities out there. So we're going to talk about that and then talk about like what you're going to need to be able to leverage those dollars because it's not just a piece of paper in some cases. It's you have to actually know what you're doing and fill out the applications correctly. So we're going to talk about all those details. So it's a kind of an interesting conversation. But while you're on the road, I mean, who's taking care of the farm here in April? What are you doing?
Nobody. That's the problem. I need to be home getting some work done, Renee. And these temperature swings. It is hot, 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 and cold, cold, cold. I keep thinking it's spring and it's early April in some of the places. And I've seen tractors out in the fields. Actually, into March, I saw tractors out in the fields when I'm across Illinois. So, yeah, got to get going.
And for me, I have seasonal allergies. So the winds, when they just flip directions constantly, I mean, I don't even know what I'm allergic to on any given day because you don't know what's blowed in that day. So, and it comes from the north, it comes from the south, it comes from the north, from the south. It's kind of been a wild spring. So, well, I guess your temperatures in the ground, though, just sort of probably keep climbing up gradually, even though you have the weird swings. So you'll be able to plant. But what a wild spring it's been.
Yeah.
All right, so today we're going to talk more about funding. And so we get this conversation all the time. And we're here to tell you one, that's a barely bad excuse for why you're not doing stuff you're supposed to be doing in behavioral health, just like workforce. We don't want to hear either one of those as your complaints. So now that you have, there are options for funding, and there's a lot of things for technical assistance and consulting and finding funding for help. So Jason, kick us off. Like, why did you get started thinking about this topic in the first place?
Well, people always ask us, when we're talking at conferences of, well, how could we go do something like that? Or how could we get a coalition to work together, to work on social determinants of health or to work on community health and well-being? And, I kind of look back, Renee, we've been funded for a lot of projects over the years, and they have not always been very traditional sources of funding. And it's not something we talk a lot about, but I think, it's an interesting topic if we kind of walk back through all the different types of entities that I never would have dreamed of going to fund projects. And some of them are larger scale projects that we've been able to sign on to and lead that probably never would have happened if we didn't really get outside of the box and think about who can actually fund this and who's interested in funding health care type projects.
Right. And it's really interesting because the federal government, and this is one of the things the state of Iowa tried to do recently, is to start looking at the dollars that come into the state because those dollars from the federal government have been very siloed and very separate. So there's pockets of money that come from the federal government sometimes that are in pockets of grants that then go to states, and then the states have to use them or lose them.
Right.
That's a pocket of money. There's also state funded entities that get dollars. Then there's private funded entities that are all over the place. So today we're just going to really dive in and talk about, I mean, and this, a lot of this list is just our own list of what we've been funded by, which is wild
Right.
enough all by itself. And there's probably more than this list. So if you're out there listening and we didn't hit something that you know about, feel free to comment and tell us what all you know too, because this is a pretty long list and we were just thinking through like our own situation. So how are we going to do this? Are we going to go from smaller to bigger? Or are we just going to kind of dive in and be like,
Why don't we start local,
okay,
local state and work our way up to kind of federal opportunities? Does that
okay,
make sense?
I like it. Let's do it.
I mean, so, I always look local, right? Like there's local foundations, United Way, even for smaller projects, thinking about service clubs. Like I think about Kiwanis and those other types of clubs, right? So locally, there's lots of options for money, but are you out talking to your local chamber of commerce? They do care about social determinants of health, as does your local hospital. And most hospitals, even small critical access hospitals, have a foundation connected to them that they fund things that their needs assessment says needs to be funded. And so it's at least something to look at and ask some questions to start thinking about. And it also helps you start thinking about partners, of what would they like to see happen in your local community and how can you plug into that?
Yep, you just mentioned on a previous episode about the 1 million cups and how your
Yeah,
service organization was the first one as a service
yeah,
organization to even talk to them, right? And so
right.
there, how many things like that are out there where maybe your organization hasn't even begun to even bridge that gap to have a conversation, and you guys were welcomed and able to come present and talk. And so, that would be offered an opportunity for others as well, but those connections aren't made. And it goes back to what we talk about connections, and collaboration is one of our big key pillars of our business. And this is one for funding. It really, really matters. It's kind of a network, and it's collaborating and working together. And sometimes, I mean, we're going to dive into some more of these people, but sometimes too, for us, it's answering the question they need answered. And so we may bend what we do a little bit to help them, because groups out there need somebody to do what they need done, that they may be getting money for or whatever. And if they can't have that funding, maybe we can help.
And don't think of it as you just go get funded by one source. You
Right.
really have to think as braided funding. And so we're doing a project right now that hits a local foundation that's funding a quarter of the project. And then kind of as we talk, we'll talk about how we were able to leverage some federal funds through a federal entity to fund the rest of that. And so that's an important thing to think about, right? It's not just looking for one person to fund you, it's how can you braid the funding and use multiple sources of funding to get toward your goals.
Right. So outside of like the really local community, then we start thinking regions, districts, sort of a little bit bigger. And so what we started, a lot of our work started with mental health regions. And at the time, mental health regions had dollars, and they were going to have to give those dollars away if they didn't use them. And so there was all kinds of money sitting there available for consultants, for technical assistance, for projects, if they could prove that it was adding value to what they were trying to do. So you want to talk about that a little more, because you've done several of those.
Yeah, creating efficiencies, promoting collaborative care, changing practices and policies of organizations, kind of that access model center approach that we did for one of our mental health regions. And so, that was really a great way to keep dollars local and work directly with providers. And as we see consolidation, across the end, we see it across the country, right? Um,
Mhm.
it seems as though those a lot of those things go statewide, right? So now we have an ASO in the state of Iowa. But whether you want to talk about ASOs or MCOs, there is opportunity for some of these projects to be funded. Managed care organizations do have dollars set aside for community reinvestment, and most all states
Mhm.
have that. Sometimes it's hard to get that money, but there is a way to do that. And so I don't want folks to think that they can't. It can be a little tedious at times, but you really need to build relationships with those folks who manage those dollars and figure out how to access them. Sometimes it's an RFP, sometimes they just have dollars that they can earmark for certain projects. And remember, the answer is always no if you don't ask. And so I'm a big advocate of going and asking. I'll give an example of we asked someone for some dollars and we got dollars. And it's really quite amazing how if you're just asking the right people the right question, it's amazing what can happen, right, Renee?
Yeah. When you mentioned managed care organizations, Delta Dental is one of the big ones in our community. And
Yeah.
you don't normally think that dental would do
Yep.
behavioral health, but they even figured out with social determinants of health that there's a mental health component from the dentistry perspective. And there's dollars from that organization that I don't know that I've personally gotten them, but I have been parts of projects where they've contributed to the project, and it is in the mental health space. And so that is an organization. If you can show how your piece of work and what you bring to the table benefits what they're trying to do for social determinants of health, for whatever background, it doesn't have to be a mental health organization. And so sometimes we get that really wrong. Same is true for the really big healthcare companies like Wellmarks, Blue Cross
Right.
Blue Shields, the big ones like that across the country. They all have dollars that are community focused. And a lot of that can go to consultants and to positions and to jobs if you can tell them how it will benefit them. But a lot of times, again, you don't have those relationships to ask those questions. And so they've got dollars that absolutely are earmarked for that. That'll just sit there unused if it's not spent. So why not you? That's always the position I take is, well, why not me? I should at least try to see if I can do and give and bring to them the value they're looking for to help them, because they have goals that they're trying to meet. And so we have goals of getting work and doing our job, but they have goals. And if those two can come together and we can collaborate in a way where we win and they win, What a great deal. And so that's a really important piece. So when you start thinking past that, we kind of got there with the MCOs, but statewide. So what are other statewide opportunities you've kind of run into along the way?
Yeah, I think about associations.
Hmm.
And so when I think about behavioral health associations or hospital associations, we've had really good luck of leveraging dollars because sometimes associations manage other dollars and they're considered a pass-through, right? So,
Mhm.
in Illinois, we're doing some big projects with the Critical Access Hospital Network, which is an
Mhm.
association of critical access hospitals, and they manage the flex funds that come from the federal government. And so, we're able then to say, hey, here's a project, pitch an idea. And they're like, we really like that. We want you to do a pilot. And then we go back and pitch phase two, and see if we can continue that. And so, I think about other associations we've done work for. NAMI, I put it in the association bucket, right? The National Alliance of Mental Illness. And so we've done work both nationally and with our local state of Iowa chapter of NAMI in the same way that they are able to leverage federal dollars or grant dollars that come through NAMI National and then flows to us, or they leverage foundation dollars to do
Mhm.
specific projects.
Mhm.
And then we plug in and do part of that. And so they've been a great partner over the years, and we're still in discussions with them pretty regularly about what are other things we can do or where can we plug in if the funding comes down that they think is going to come down. And so we're also looking at them partnering with other associations, right? Because
Right.
they can braid their funding together to work toward a shared goal that they need some technical expertise and subject matter expertise on for us to help them drive that forward.
Yeah, and it's a great thing for the organization. So if you are a NAMI state chapter or a national chapter, and you can say that you've done these things and gathered this data, then they leverage that for additional grants, for additional dollars, for additional things. And so it becomes it really is a partnership where not only do we get work that we need to do that we're excited about, but then you give them the opportunity to gather the data, to use it for what they're trying to do. And I know one of the projects we did with NAMI for the state, they used it to leverage to be able to work with the state of Iowa to have their programming in lots of institutions across Iowa. And we helped on the consulting technical part to get that done correctly and get the bid correct made. And we got that part was our work, but it then turned into their work of turning that into an ongoing program for them. And so sometimes it is maybe we have a piece of that, or sometimes maybe we have the bigger picture. So talk to us about how you've been involved. I mean, we get money directly from state legislatures, and we've had that from multiple states,
Right.
but then also those centers of excellence. Try to talk to us about what's a center of excellence and how are those kind of connected to the state legislature? They're kind of connected in some ways.
They are, right? And so, our state earmarks money all the time, right? And so in Iowa, we love our centers of excellence. That's been a thing. So a lot of money gets routed to institutions of higher ed, and then they create, learning centers or find ways to provide technical assistance back to the provider community. And so that's certainly a way to plug in and provide local technical assistance because a lot of times they don't have a broad enough reach. And we'll talk about that more in a minute. I'm going to flip over though to working directly for legislative subcommittees. That's been something that that's kind of our niche, Renee, is as legislators, subcommittees need to do research on a specific topic. A lot of times they'll have money for subject matter experts to do a report. And so we've been pretty good at plugging in to when the issue is behavioral health or substance use, plugging in and saying, "Hey, we can deliver that report to you." And so sometimes there's an RFP involved. Sometimes they just are looking for someone with some expertise, and there's not always a lot of rules. It's kind of like the Wild Wild West because they don't have to follow the same rules and regulations of bidding things out, or they just don't. I'm not sure which one it is, Renee, but that's where we end up.
Yeah, and that just reminded me, we skipped one level of government, but county government.
Oh, yeah.
We talked about it with districts and we talked about it sort of with regions for mental health, but there was one county in North Dakota that was looking for a free building that they were looking specifically like, can we bring behavioral health to this? And I got dollars directly from, I think that the county would be county supervisor type level of government to specifically do that. Again, they're looking for expertise. And that came off of, I had worked with the state of North Dakota first. So they knew of my expertise there. So then the counties thought we could help them specifically. And then I got paid directly from a county at one point to do something specific for one of their own county buildings. And so, that really can be another level of government as you're kind of trying to get bigger here, thinking about, you know, uh, statewide looking at that. But there are sometimes that those things lead to the next thing. So one of the big things that you and I've done and we've done really well. I mean, I've been consulting now for over a decade, and most jobs, it takes them a little while. You don't get I don't want people out there thinking, well, you just get the next one the next year. But if you did quality work, the cycle comes back around. And I've seen this now. So North Dakota did the first one in 2011, 2012. Then Jason and I were invited back around 2021, 22. And then now we're, doing some other things and looking at that again. So the cycle in government can be longer, but if you've got a good relationship, it swings back around. And so some of these things we may have done a project with NAMI years ago, and then it sits for a bit, and then they go on to other things, and then they may circle back again. So it's also about your follow through, your follow up, maintaining those connections on the back end, and that's really an important part of this. But before I get off topic, let's keep going on our list. So after the states, now we're talking like national. You kind of got into national with NAMI because that's a national
Yeah.
institution as well. But what are some of the other national types of things you're seeing out there?
Well, so some of the centers of excellence actually come through SAMHSA or the different regions. I mean, so there's lots of different regional entities of how SAMHSA breaks up how they distribute money and technical assistance. And so we've actually had some good luck. And literally, it came from a conversation at a conference. I was speaking at a conference and we wandered by a table and we're like, well, this is interesting. Tell us what type of technical assistance you provide. And they tell us that they provide, it was a local university in a connecting state. And they said, we provide technical assistance all over the Midwest. And we said, well, how about our home state? And they're like, yeah, we'd like to, but we don't know anyone there. And so we said, well, hi, my name's Jason. Now you know someone there. And lo and behold, we're going to be doing technical assistance for this federal entity that's through a center of excellence. And it was that simple, right? There was no RFP. We actually had someone connected to us who had a ready-made project, we had been working with, a group, and they said, we really want to do this, but we don't have money and we don't know where to go to find money for technical assistance. And we said, actually, we can find the funding for you if you want to do this. And we were able to link the funder to the local group to be able to do this project, right? And that pays for us to go and do the consulting. And so again, it's about relationships, right, Renee? It's about, being in the right place at the right time, but it's about making connections and knowing the right people to fund the right projects that are a good match.
Yeah, and I would add to that, it's also about reputation. So
Right.
you have to do a good job at the one you have, because word gets out that you were good. And the big things are on budget, on time. And so if you're on budget, on time, anybody will work with you thing, because we get jobs, and you're in the middle of a couple of these seasons where the timeline is a bit much. They maybe didn't bid it out the first time when they had the most the
Right.
time, and so now the time is getting short, and so you're willing to take it on. So there's a crunch. You also get paid premium when you're in those time crunches, but it does require you to do that little extra effort to get it done timely so that you can use the funds. It's always a use it or lose it situation when you're working in government. And so if you can do that and have a reputation of getting it done and staying under budget, the ones that, where this does not work are those places that promise work of technical assistance or whatever, and then bump the budget at the end and blow the budget or
Hear
stop
that.
short because they ran out of money. Those folks don't really get invited back to the table. So those are two big principles we work on, is, making sure we get it done and do it right. And so that's a lot of work on us to keep the scope within the scope, to not let it get bigger than it's supposed to be, to really nail down the contracts. And we've done some of that wrong, and we're getting better at some of it, because it's on us to make sure we hit those markers. And so that's a really big piece to think about when you're thinking about funding. One other one I wanted to mention is Arnold Ventures and other groups like that, Warren Buffett, the Omaha Foundations, things like that. Those organizations have all kinds of dollars, and depending what you're working on. So Arnold Ventures, we did an entire episode about that after I went down to visit with them. And what they're working on today is building evidence in certain areas and around policies that are economically driving our national debt, basically. So they're looking at those big things that drive big dollars, like corrections and healthcare. and a myriad of other entities. And so what they're asking, and they're bringing people in that do research and saying, we want to give you funding if you can show a causal reaction and cause why this causes this in ways that we can actually impact the economy, we'll hand you money. And there's like a bunch of different ways that they do that. And they can give you, there's different paths. There's some RFP paths. There's different things. But these groups are out there. I was totally new to that kind of concept. I didn't know those are there. But they're looking specifically to build research, and those research entities then need people that are going to go out and do that work. So what the partnership then is, it becomes a research entity like folks that are economists or whatever, but somebody has to do the technical assistance and has
Yep.
to do the work on the ground. And so we can partner with folks like that and go do the piece that we're good at while they collect the data for their research.
We recently interviewed with a group that we learned was actually a think tank out of Chicago, where we interviewed to do a project for them, where we would bring the subject matter expertise and the facilitation skills to help them better understand an issue. And so it is a whole new world out there as we discover these things and learn about these collaborations of folks from all over the country who are looking at one specific issue and how can they come together. And that's the same issue we hear about in a lot of areas where we're working already. And so the more we can collaborate and figure those things out, the better, I think.
Yeah. So when we're working in this space too, what a lot of this is trying to do, there are a lot of folks are trying to gather data and information. And so talk to us first about why that's so important. Why in all of this work with technical assistance are they wanting to be so data driven? What is behind that, Jason?
Well, I mean, we need to know what changes we're making if they make an impact or not. And so we have to measure that change. And, I was spending this morning actually building a presentation on we're kicking off a couple of these projects, one in Illinois, one in Iowa, really along the same timeline, where we're going to be bringing groups of providers together and introducing changes to their system, to how they collaborate, to how they provide care. And then we're going to measure if we see an impact in the local hospital, if we see an impact in the emergency room, because we need to show that working together actually saves the system money, because it comes down to dollars, right? Data equals dollars. And so, especially in the day and age we find ourselves today, we can't back down from that. We've got to be really open and honest with ourselves that we're going to have to do more with less over the course of the next 4 to 5 years. So how can we help prepare everyone to be as lean and as efficient as they can to still do what they do in their local community? And that's why data is so important, Renee.
Yep. And you shouldn't be afraid of going after a project that maybe not all the data is there, because I can give you a perfect example. I don't remember how many years ago it was, I was asked to map out like funding for the children's mental health system in our state. There was a lot of gaps to that report. I mean, there was a lot of gaps. And at the time, we were very siloed. Public health was still separated from HHS. Federal government funding wasn't even looked at by the legislature, all these things, right? But that I think was part of the driver for some of the realignment. Now, I don't want to say I was the cause or whatever, but my data definitely backed what they were trying to do with realignment. And so some of the things that have come out of realignment is putting a bunch of groups together into HHS in our state so that it's more into one system, and then getting rid of some of those side systems that just were taking money, and then starting to take a look at what are the federal dollars that are coming. We would have literal federal dollars come to the state that HHS didn't know was here. I mean, I've been part of a couple of things where different groups, you were part of this too, where a CCBHC over in Eastern Iowa got a grant from the federal government, and the entities didn't even know who they were. And I got the phone call from the state going, do you know who these people are? That's weird. And so, yeah, I did know. But that's weird. And so it's like, you got to work on that. So that's some of the stuff the state's doing. So we did a report that basically said, hey, here's a lot of gaps. Same thing, my first trip to North Dakota was exactly the same thing. Boy, were there gaps there. They didn't even want to know the budget for the state hospital. Nobody even audited. They'd never even had an audit. Nobody had even talked about how much it cost, but yet we were going to keep pouring money into it. And it wasn't until you pointed those things out, they're like, hey, maybe we shouldn't just put money in a hole. Maybe we should figure out what we're paying for. And that now has led to a decade of plus of transition up there. And they really are transforming that system because people are looking at that. So sometimes you may not have all that information, but it's your job to make it very clear where the gaps are and where the data is missing. And that's when those think tanks and those research groups can come in and say, hey, we can do some research here to fill this gap on what this is. And so it takes a lot of time and it's a big picture, but it all matters because other people have those gifts that can fill those holes that maybe we aren't good at.
So I think you just moved into the next steps, Renee. And I think this is kind of the takeaway of this podcast today is how well can you tell your story to get that funding? And, I think that's something that we've gotten a lot better at.
Mhm.
One of the things that we're doing right now, and I'm going to give away one of our secrets, but if you go to our website, you can see white papers. We're now developing white papers to better tell the story of the projects we've done so we can better show how we can impact other communities and other groups moving forward. And I think messaging is really important. And it's how do you talk about this to those large funders in a way they hear you and see the value of doing something. And I see this missing in so many small communities where a group of providers or a small hospital and some folks want to come together to make a change, but they're not clear on what they want to do, on what metrics they want to change, and how they want to do that. And so it's not as easy as saying we're going to pick a data point and we're going to do something, right? You got to be able to tell the story of how you get there. And I think that's one of the things that we've gotten much better at over the course of the last decade is how do we tell the story and how do we move everyone forward?
Yeah, and you just mentioned it. We're just now learning that we're supposed to go back and do the follow-up to use it as leverage to do more, right? Because you're so busy move and everybody we all are, right? So you as a small entity that may be listening or even a large entity listening out there, you may have already done some really great stuff in research. Maybe you have really great data. You just haven't put it together in a way to to show other people the great stuff you're doing. Take the opportunity to do that. So it may not even be that you need the technical assistance. It may be we already did this and we can already prove this really works and we already have this great data. Tell that story. And so yeah, it's on both ends, right? It's like you may need the help to even get to the story, or maybe and you just haven't taken the time to write the story. And that we all get busy and we may not go back to, hey, this is why this worked. And you and I talk about this all the time. You have data, we've collected all of it, but you may not even go back to look at it to say, did it really work or not? Right. And almost never do you say that didn't work at all. We should stop doing that. Like that's just not the entity we're in. We just sort of keep that, maybe put a little less resources toward it, and but add a bunch more stuff. And so now we're doing 100 things when we should have really just dropped the stuff that we knew a long time ago didn't work. And so, this can really be helpful in that endeavor. So, let's just kind of recap here who we're talking about. So you start with your local clubs, like your Kiwanians, your United Ways, your local associations, like your local chapter of NAMI, and then you go moving up. So Jason, kind of recap it for us. We start local and then we go where?
Start local and start moving up, looking both at state and county entities like your administrative service
Mm.
organizations that may manage your behavioral health system. It may be a county behavioral health system, depending on what state you're in, and just kind of follow the flow of who has money in your system, all the way up to your state Department of Health and Human Services or Public Health, looking at associations all along the way, whether it's regional type of associations or statewide associations. And then once you get to that point, you look at funders like MCOs, your Wellmarks, your health insurers that all have foundations connected to them, your hospital systems, your local hospitals, if they're part of a larger healthcare system, they've got foundations associated with them, and then figure out how do you access some of those dollars and how do you match it up to their goals and where they're going, right? So it takes a little bit of legwork. You have to know like what initiatives are they supporting at the time? Does what you want to do tie into their initiatives, and how can you leverage that to benefit you? And then from there you can go national, right? You can look at the SAMHSA, the federal entities, and how does their money flow down? Where are the we talked about where does technical assistance lie within their systems, and so we talked about those centers for health or the centers of excellence. I couldn't think of centers of excellence, Renee. All those centers of excellence that exist all over, right? Because they're supposed to be helping to go out and provide coaching and technical assistance. And I know from being around them that they aren't always effective. And I have opinions. I won't share them here. But that's not always the most effective way. And so you have to be out there asking them for things in order to get things, in my experience to get their help and assistance and technical support and coaching back to your local community. But if
Yep.
you do that, oftentimes they will deliver.
Yep. And it really, what Jason said right there was really important. You need to know what they're working on and tie what you're working on to it. Because if you go to like the Arnold Ventures website, they've got a list of priorities. They've got these are the things we're working on in the area of gathering data, and that's evidence-based, these things. Well, if you're working on something that is related to that or can connect to that, then they're going to be very interested for what you want to do because they have dollars specifically to do research, right? So you've got to know what those groups are doing. If you come in with just your own idea that doesn't match anybody else's and you're trying to shove it down, that hasn't worked near as well. And so you're welcome to give that a go, but it's not usually what's going to happen. Before, I mean, we weren't talking about this today, but on a side note, a lot of those exact same entities have dollars for training purposes and for conferences or sponsoring conferences. So it's the same people. So a lot of folks on this listening to us, you're out there, you may be going to those conferences and you see those names as sponsors. Those dollars are different than the technical assistance dollars, but they're the same people. So if you know the people and they've worked with you for your conference, they also often do more research, do technical assistance, and the dollars are separated that way. They're not all in one big bucket. So just don't assume because you got dollars for your golf tournament that they're not going to give you money for consulting. It's different buckets. And so, but there's the same people from the networking perspective. And I think we forget that too. We think maybe we can only get them to sign up for the hole-in-one challenge. And that's not all they're there for. I mean, that's not all what healthcare is for.
And maybe we want to leave the final takeaway is this isn't something you're just going to get online and start Googling around or asking ChatGPT. We've found a lot of the connections and actual work that we've done by going to the conferences and going around to each table and learning about what people do, and then learning about how we could connect with them, and in parallel do a project together. And so I've been kind of amazed that when we end up in conferences in other states and national conferences, that's where we've created connections that have then led to us doing projects more so than anywhere else, more so than just send. I mean, we send RFPs out the door fairly regularly, right? Like stuff gets sent to us. We would rip out an RFP, we do the interview, and then we may or may not get a project, right? That's part of what we do. But those personal connections have gotten us just as many projects that didn't even include an RFP. And sometimes it's amazing how much dollars go out the door without an RFP, Renee. I mean, there's been sometimes I'm like, should you all be having some type of process to do this? But
Right.
I'm not going to ask too many questions, right?
Right. Well, I mean, I can back you up. That Arnold Ventures project we have is shy of $1 million with the
Yeah.
Board of Parole. And that started with me talking to a young lady named Emily, who happened to be a sponsor at one of the events I was at. And she was standing at the sponsor table in the meet and greet part, and nobody was talking to her. And so
Yeah.
Brent and I happened to be at the meet and greet, and we're like, she seems nice. We should go talk to her. And that conversation that night turned into she didn't know for sure, but she knew what they did and they might be interested. Maybe I can connect you. And it started there. And then there was a really long process, and I didn't have to do the process. That's the best part of that. The
Good for you.
researchers had to do the whole RFP process for that. But there was a long process in boards because it's a third party situation. But it all started with a conversation. And so what Jason's saying, a lot of this is that. So if you're out there listening and I have no idea who to talk to, you know us. And so feel free to reach out and chat because we're always looking for new people to work with us. We have partners. That's part of our title. It's who we are. We partner with people too. So if you're just really stuck and you're really stumped, and we've met really great people, I'd also recommend all the people almost every single person we've ever brought on this podcast as a guest has really good in this area too. So
Yeah.
there's other people you might be able to reach out to and think about and talk to. But before we go today, I want to do the recovering politician self-care policy of the week. This is a new one for you. Do you know that there are books out there that I don't like? And I bet there's books out there you don't like. And do you know what? You don't have to finish them. You don't have to read them. Now, I would say they're bad books because sometimes right now AI is writing books and they're real bad. Like they're just bad books. But most of the time, it's not necessarily the book is bad, but maybe my mind's not in the right spot for that type of book, or maybe that's not my favorite genre, maybe not something I really care to read right now. And it's just life's too short, man. Have you been to a library and just seen all the ones in the shelves, and that's only a piece of the ones in the world? And so I really started rethinking that because I used to try to give it the college try and just try to get through the book. And then sometimes I'm like, I don't know. Also, to be fair, some of those self-help type books, you can understand the premise by reading the table of contents. And so sometimes it's just not worth it. So for all of you out there that are readers like I am, it's okay. Skip some chapters, get to the end, see how it ends, and move on. I mean, you don't even have to, maybe you don't even care what the ending is sometimes. It's okay. Life's too short to have bad books, so just keep moving. Jason, I don't know. Probably, I don't know. You're a big reader. I guess we've never really talked about this.
Not, I'm not a big reader. I get labeled in my house because my wife's a big reader.
She
But I
is.
but I like this mantra of sometimes you just got to give up. So I mean
That
like
was not what I
sometimes
was
it's
shooting
okay, just
for.
give up and move on, right? Is that the takeaway? Is that the takeaway?
Actually, yeah. There's some books I've started and I'm like,
Yeah.
I don't why did I pick it up? And to everyone listening, it's my own fault. I don't read the jacket necessarily. Maybe the cover looks cool or somebody recommended it. So I pick it up and then I'm reading it and then I flip to the back and I'm like, I would have never read this if I'd have just read the back of the books. It's my own fault, but sometimes whatever. All right. Well, thanks everybody for listening today. Hopefully you found this interesting. We thought because we really have had a wide variety of background of how we've been funded that you may want to hear about that and know that there's a lot more options out there. There really are a lot more dollars even today set aside for research, for technical assistance, for consulting, for help. And so if you're interested in getting somebody like us to come help you, we can help you find the dollars to make that so. But before we go, please don't forget to follow us on LinkedIn or Facebook or YouTube, and we'll send you a prize. Have a great day, everyone.